All right, we are in record mode. Okay, I'm still accepting a few people, so pardon me if I pause away, but we do want to welcome everybody to this conference call. Thank you for taking the time. Sally and I had been talking about this, and we had gotten together with our respective chiefs. I spoke over to the PD side, and we all had agreed it'd be a nice opportunity to be able to have some time with you all to let you know what it is we're doing in our departments, to be able to address any concerns or questions that you may have, and essentially to give you just a perspective on some of the things that we're doing for the city and what we're doing for the business community. And so certainly, and Chief Cameli will go into detail here, but there are things that we see that on our end where we're still trying to make sure that our crews and us as individuals are still supporting our local businesses and doing our due diligence to help support you all as well. So for us, it didn't really come down to Chief Cameli. I apologize if I'm stealing your thunder here, but it was more of a thing of, not necessarily what can you all donate, but what can we all do to help each other make it through these tough times. And if that means how do we assure that your business is still running as smoothly as possible despite all this, we want to make sure we did that. But without further ado, I'm going to go ahead and introduce Chief Mary Cameli with the Mesa Fire Medical Department and Chief Ken Cost with the Mesa Police Department. And Chief Cameli, if you would like to just start with some words and then maybe give an update.
Okay, thank you, Forrest. Hi, everybody. Welcome. It's nice to have you on here. Thanks for giving us this opportunity for both Chief Costa and myself, just to kind of give you an update on where we are with public safety, what we've been doing, and then again, like Forrest mentioned, what we can do to help each other as we go through these days, weeks, and months ahead, because we know this isn't going to stop. And when it does, we know it's not going to stop soon, but as we progressively go back to what the new normal is going to be, it's still going to be some time. So for the fire department, just some of the biggest issues that we faced today and we've continued to face during the beginning of the crisis is our whole protective equipment, making sure we have enough of it. We track that daily. We want to make sure that we're protected, the public is protected when we go into their homes as well. So we make sure that we have our gear on for both, to protect the public and to protect our members. This has been an ongoing thing for us from day one, is to make sure that protection's in place. In addition to that, we are monitoring our call volumes regularly so we can make sure we have enough resources available for the public when we respond to everybody in the community as well. So we're monitoring that actually 3 times a day. We get updates on our call volumes to see where we're at and what we need to do to add resources if needed in order to do that. We are monitoring the hospital overload, see where we are, so patients aren't waiting a long time to be offloaded from ambulances when we are responding to them and transporting them to the ER. The hospitals have been very, very good. They have not been overcrowded yet at surge capacity. Everyone's been prepared in that regard to beef up where they, to add resources where they need to, so they don't get at capacity. They have not been at capacity as of date. So we monitor that as well to make sure that when we do respond in the community that we get patients help as quickly as possible. Something we're just starting to work on now is some antibody testing for our members too, to see who has been infected, who has already had the antibodies to it. So in essence, we're protecting the public as well. So we know which members of ours have already had the virus. Now there's still research out there saying if you had it once doesn't mean, we're not convinced that it doesn't mean you can't absolutely get it again. They're still looking at all that. But we continue to look at all of these things in terms of protecting our members and the public. So when we're responding to your family members and things like that, we make sure that we are protecting and have barriers between us and the patient as well. We've been also kind of partnering with the parks in all that they're doing in feeding and doing restaurant buyout, all these kind of things to make sure that these businesses in Mesa, with this money that the city received, in order to help those in need, and working with many of the nonprofits. So the parks is taking the bulk of it. We've partnered with some things, we're helping with some things behind the scenes in terms of getting equipment and supplies and things like that to help make this program successful. So these have been some things that we've been doing and we continue to do as we're moving through each day with this and monitoring. We're monitoring daily projections of where COVID's going and the numbers in the state and things like that. So we know what to expect in the future. Although the projections still change as real data comes in, the projections continue to change. And when the peak time of when we're going to see the highest level in our state, that has changed about 3 or 4 times since the data started being actually getting actual data. So the actual peak time was very close to, it was like May 2nd, but that can change again depending on what kind of data they get. And as they start to, the social distancing, as they start to lighten up on some of this, we also anticipate some additional calls that may come of this as well. So these are things that we monitor daily for the community and for those we respond on. You're on mute, Forrest.
Forrest, you're still on mute.
Thank you very much. Sorry about that, everybody. I think we'd have this down by now, right? So one thing I personally did not, I forgot to mention is we have our Assistant Chief James Johnson also. He's our operations, oversees our operations and emergency operations center as well. Now, Chief Cost, would you like to go ahead and give us an update, sir?
Good morning, everybody. It's for those who I haven't met, then I'm meeting virtually. It's nice to meet you in a virtual standpoint. I see a lot of familiar faces. I have Minnie Salas here as well from the police department. So if I miss anybody else in the police department that might be on page 2 or 3 of my screen, then forgive me. As far as the police side, we've completely revamped a lot of the way we do business. Obviously, from everything to how we receive calls, to how we're having officers proceed out, to the facts that we're asking people to come outside of their homes when we can, when it's not a safety issue. Whether it's one of your businesses, we're asking people to come out and talk to us out in the open air. PPE, which is the personal protective equipment, has been a challenge for us, but thank goodness we have the partnership with Chief Cameli and Fire. Otherwise, we would be in trouble like all the other police departments around the country that are having issues with having enough PPE, not to mention obviously the healthcare industry, which I know is represented in here today, and those in that regard.
This is a
For the police department, our calls and the types of calls have changed. So we haven't really dipped below a significant level of reported crimes. It's just different. So we are lower in some categories and we're higher in others. Like, for example, stolen cars and things that cars being broken into at night. And then for your edification, for commercial burglaries and things that are usually in the middle of the night type of thing, we've seen some increase in some of those categories, and have reacted to it. And our officers have caught a lot of folks in progress of breaking into businesses and people's cars and trying to steal cars at night. And that kind of goes hand in hand. Sometimes we see that spike in the summer when we have more people at home, more kids at home. And now we're on an extended summer, if you will. So that wasn't a big shock to us. A lot of folks feel like, you know, maybe some of the things like domestic violence would go up. We haven't seen that, but what we have seen is neighbor trouble, fights amongst neighbors, fights in the street, some tension starting to overboil a little bit. So we're reacting to that and just adjusting our resources accordingly. So I'd be more than happy to answer any questions as far as that goes. But with calls going down in a lot of other categories, we've redeployed our officers who might be more proactively patrolling the streets to when they're either writing their paper or when they're in their beats, is to literally park in your business lots to try to go and do extra patrol, because we realize that every business is not necessarily open, although obviously this week there's starting to be some relaxation on that. But we want to make sure that we're there and we're good partners to every single one of you while your businesses are closed. And then we've seen now those commercial burglaries and things like that over the past several weeks start to really plummet because of the officers' extra effort on making sure that their black and white police cars are being seen and then that they're being seen. So we have a lot of different things as far as the community goes. Minnie and her team, Minnie works in our community engagement division, and they've had a lot of efforts working with obviously nonprofits and with the city and with different businesses on making sure that we stay connected, even though we're all basically sheltered in place and working remotely for the most part. So I'll leave it at that and then answer any questions as it goes on for us.
All right, thank you very much. Now, at this point, if anybody has any questions, if you'd like to, now we have a great deal of screens, and so if anybody wants to go ahead and just give a quick thumbs up there, we can go ahead and start taking any of your questions. I'm going to go through and scroll through the screens if anybody has anything.
Hey, Forrest, this is Mary.
Yes, Chief.
Can we have Chief Johnson just give an update? Chief Johnson is managing the Emergency Operations Center, the EOC, for the city, and maybe he has some other information just to share with the everybody as well.
Excellent, thank you, Chief. Chief Johnson.
Hello, everybody. Thanks for being here. I appreciate it. It's a good opportunity to be in front of you. Yeah, our Emergency Operations Center is up and running. We've been up and running almost since the start. The initial issues we had, much like Chief Cost and Chief Cameli said, were PPE issues, and gaining all of that and wrapping our heads around all of the PPE needs. So that was a challenge for us. We've done that. We have many folks in there working to keep the city tracking of this is a big deal. So we're tracking all of our employees. We've got codes set up to where we're able to track the funding and what's being used for this, so that any dollars that can come back into the city, we can get reimbursed for that. Is another thing there. We work regionally with our regional partners in the emergency management world and both Higher MPD regionally as well. So we stay in touch. It's all about establishing relationships, and we have great relationships with our neighboring departments. And so we just keep ahead of any trends that start to develop and things like that. So, but anyways, just being in there in the EOC is good. We also keep close contact with county and public health, which they have the latest and greatest information, working with the CDC. So we make sure that the city is following all those rules that they're passing down, and of course from Governor Ducey and things like that. So working hard in that area. I appreciate, everybody in the EOC and everybody in the fire department, the police department are all out there working hard to keep the community safe, and that's our number one goal right now. So if there's, as people have said, if there's anything we can do to assist, please reach out and let us know. Thank you.
All right, Chief Johnson, thank you very much. There is a question that's here in the queue, and the question is about mental health calls for both police and fire. Has there been an increase? And this person knows that we have COPA Health reached out in one instance, and Commander Peters was a great help. So it looks like PD was able to help out on this particular one. But Chief Cameli, do you want to address that?
Sure, I'll be happy to start. You know what, since our call volume is down right now, it's hard to say our calls for that has been increased, although we know that that's coming. We're pretty much looking at the data and assuming that that's our next increase. And so we have a meeting actually this very week we have a behavioral health unit. We had a partnership with CPR Behavioral Health here that we had to cease for a while based on so they wouldn't be unnecessarily exposed when this first broke out. But we have a meeting this week to kind of bring this back for the community. But we know that we're going to see a lot more of these type of behavioral health calls now that people have been quarantined for 6 weeks, and that it's going to continue. So not only for the public, but also just watching, out for just employees, general city employees too, that we're going to see this on the rise, people quarantined. So we are already anticipating, I have a meeting lined up this week to kind of bring back this unit to kind of help with that, what we anticipate seeing in the community in terms of behavioral health, that the call volume in this arena will be increased.
Thank you, Chief. Chief Cost?
Yeah, and for the police department, we're actively tracking mental health related calls. Suicides is a question I get an awful lot as well, and we haven't seen the spike that we were anticipating. And I think I'll double down on what Chief Cameli was saying is, a lot of the calls that we go on, I described a little bit of some of the violent crime as far as fighting and stuff like that are going on, whether we're having a mental health component to that. We haven't seen it. I also am getting updated later this afternoon on our latest numbers, because we run off a ComStat model. on our mental health related calls. And I'm really curious in this last period on whether we did spike or not. So the question is a good one. What I can do, Sally, is once I get that information, I could forward that to you as far as our latest update, and then you can get it out to the chamber and the folks that are asking the question. That way they can get there. But we have not seen the spike that we actually thought we would.
All right, Chief Goss, thank you very much. The next question, and this is just so typical of our group here, is what can we do for our police and fire departments?
Yeah.
Chief Cameli?
Sure. Thank you. That's very kind. You know what I'd say is just keep practicing, you know, everything that we're doing in the state in terms of social distancing and all of that, because that really adds up. And so all of us working together on this really plays a part and a key part in the, you know, in the flattening of this curve until we can get through this crisis. But if we can keep that curve flat by all of us still doing, even when we start to open up, just make sure we have the distancing and make sure we practice those things that the governor's office is asking us to do in order to keep the spread down, just to kind of reduce the number of calls and the number of folks that are getting sick. But I think they're coming up with strategic ways to still allow businesses to open up and still practice, you know, still applying these kind of practices to keep the numbers at a lower level. So we don't get to the point where we run out of supplies and hospitals are at surge and we can't treat everybody with the same amount of care because there's not enough equipment. If we keep it at a level that's manageable, then everybody, you know, there'll be enough equipment and everything available for patients that end up in the hospital. So that's all I ask, is if all of us do a little part, that kind of helps the whole community as a whole. And thank you for your continued support of public safety. We truly appreciate it.
Chief Cost?
Yeah, you know, for us, we really appreciate the offer, and there's definitely behavioral things that we can hope to get from the chamber. Is as we roll this out and Governor Ducey has his phased in plan, I know each of you will have your phased in plan if you're not in the middle of it already, and really you know, operating under the rules of the governor's order. We have not, and we're proud of this, we have not had to arrest or cite anybody in the city of Mesa yet for completely going against the order, whether it be the order from the city of Mesa that was the original order, and then now the governor's order. So just helping us keep everybody safe and distanced, and while we phase back into the new normal, you know, we'll ask just for that continued cooperation, because our mission has been education. So if we go out to a business at 123 Main Street on a report, and we get you know, maybe about a dozen a day or more reports where people are violating the order, then we go to either the business owner or the manager or whoever's in charge to just explain what the order means, ask for compliance, and then then we gain that compliance. We haven't had an issue since. So I think it's just that is working with us together as we get into this new norm, because it's unprecedented and we've never had to do it. So we're in the same boat as everybody else. We're no different than any other organization. So just that type of cooperation. And then we will continue to ask as the challenges come to what we need. Obviously, we're you know, we're in the middle of exercises because of the financial hit, and you know, whatever we can do to help out you, I think will be that vice versa type of ask down the road, so we can kind of pool our resources together to help each other out. So I don't think I have all the answers of what exactly that would entail, but I just know our working relationship has been so good with everybody that you know, we'll definitely won't be shy to ask of what we can do, and then vice versa.
Thanks, Chief Cost. Now we have another question here. It says, we know that Mesa got something like $90 million for IT. Have your departments received special funds from that for cyber? If not, do you know when funding will become available for specific departments like yours? Chief Cameli?
Sure. Thank you. Great question. So the city did receive $90 million, but it's for anything basically COVID related, is my understanding. And so we are tracking all of the funding that we are spending related, anything related to COVID, whether it's folks in the EOC that are helping and ordering supplies and logistics surrounding that, even with the food that the city is working on distributing to those in need that have lost jobs and things like that. Yes, so all of that is being tracked to be covered by the 90 million. Some of our supplies and all of that is also somewhat being covered by FEMA. Anything that's related to COVID, we are tracking. So with the 90 million and with the FEMA dollars, that should help fund a lot of this additional dollars that have been spent based on the pandemic. So yes, the city is utilizing this across the departments in order to have us track the COVID related activity that we're doing.
Chief Cost?
And specific to the IT related, it's so new that the money was just granted. So I know that our IT director for the police department, along with a lot of our command staff members, are putting together proposals that may or may not fit within that $90 million award. And because there's guidance, there's obviously some rules that are attached to it, and but it all is pandemic related. And so there's some things technology-wise, and I'd be premature to speak about it right now in this meeting that we could use, I think, both in police and fire, that would help, deal with pandemics, and not only just this one, but any future. So we're looking at a lot of those type of proposals, and those staff proposals are due pretty quick because it is time sensitive. So I think here in a few weeks we'd have some answers on what kind of technology we'd be looking to leverage to help in these situations, to answer your question.
All right, thanks, Chief Goss. And there was a question before we get to yours, Kevin. It was a tailspin off this one. Is would it also, let's see, if we've seen an uptick in cyber attacks against any of our individual departments, Chief Goss, is that something you've seen over in PD or any attempts?
I haven't been notified of any increase in the potential cyber attacks. We're secured pretty well, but I haven't. That hasn't been spoke about. We meet weekly with our commanders and IT, and that so we have not seen that.
Thank you. And I think Chief Cameli and Chief Johnson, if you don't mind, I can answer on our behalf. We've seen something through the city via social media. There was some attempted phishing through Facebook, but as far as our actual city is concerned, IT has it pretty well locked down. They even have some things in place for us when it comes to remoting in and telecommuting and the such. So our city IT has been extremely active in helping secure, keep our system locked down. There is another question here, Kevin. Thank you for your, well, everybody, thank you for your question. Let's see. Has there been any uniquely difficult cases with fire and medical or the police department, like a case that was made much more difficult because of the current COVID-19 pandemic? Chief Cameli?
Sure. Probably the most challenging thing for us is when we go into assisted living places, and we're working with them to bring patients like out, just because walking through the hallways, we don't want to spread anything. And so we're working with these facilities to bring the patient out towards the front to keep this patient kind of confined so we don't infect other patients. So nursing homes, and the same thing as Chief Cross mentioned, when we go to homes and when there's known COVID patient, again, we ask if the patient's well enough to either come meet us outside. If not, we absolutely go in. But if they can meet us out, just to limit the exposure, because we know how easily this virus spreads. So we're working differently and responding differently to these types of calls. We bring a chair, we have a chair, so if they come outside, we have a chair they sit on, so they're not just standing up. So we've kind of changed our operation a bit on this COVID, just to do whatever we can to reduce the number of people that get exposed every time we go on these patients. In assisted living, it's a little more difficult because that's where everybody lives and there's large numbers, but we do try and get them to a place where we can treat them in an area where we're not going down the hallways and it's specific rooms, but to put them outside, either outside or in an open area where we can work on them as well. So it does change our dynamic a little bit in terms of exposure, and we continue to modify that to meet the needs as we go on more and more patients with this virus.
Chief Costa, anything interesting, any unique challenges?
Well, yeah, for us, every single call is so unpredictable. So, where the officers are going on a call that seemed to be, I guess there's never a routine call. We have strict protocol in place for the PPE, the protective equipment, but where they may be taking a report call and not have to, they can keep distance. all of a sudden that could change in a heartbeat, and then somebody is approaching the officer and they have to have physical contact. So just getting the right recipe in order for the officers to make sure they have the proper protective gear on any call has been a bit of a challenge. And then one thing that's unique to the pandemic is the amount of suspects that are claiming to have COVID-19. It's two-pronged. Some of them have threatened to either cough or spit on the officers, and that you can see that happening nationwide. And obviously, that is taken serious whether there's a pandemic or not. But you know that's a deadly threat to the officers. So dealing with that has been a unique challenge to the police department, and obviously those folks are going to jail. But on the other end of things, when they are going to jail or being booked, they're trying to use COVID-19 as a reason why they can't go to jail, because they're trying to, you know, kind of piggyback on some of the national narrative is, hey, you should be letting more people out of jail than you're putting in, because then you're affecting the jail population. So they try to leverage COVID-19 that way too. So those are things that our officers are dealing with as I'm speaking right now, I'm sure.
Okay, I do not have any other questions in the queue. Is there anybody who has anything that, any more questions? Dave.
Quick, can you guys hear me? Yeah? Okay. I just want to give a quick thanks to Mesa PD, particularly their traffic division. You know, most of the time we see those guys in our rearview mirror rather than helping us out, but the traffic division has been absolutely amazing to work with as we've done our food distributions at the Mesa Convention Center. They help us in everything from logistics to the security of the lines, and have put a very kind presence to our clientele that comes to that. A lot of people are really worried at that time, but Mesa, the officers have been pretty kind and helped people in a way that they felt very comfortable, I thought. So Chief Cost, a big shout out to you guys for the great work that you've done there. I think our need's going to start to diminish. I wanted to let this group know what our numbers have been looking at. They started at 500 people per, we usually see 500 families per Friday, and that number quickly went to 1,200, then to 2,300. We remained about that level for 5 weeks in a row. Now we've seen it drop to 1,800 for the last 2 weeks. So that's a good trend. We like seeing it go that way. But to meet that need, because of the heat, we're going to make some adjustments to our distribution. If you know people that need food assistance, we'll be distributing out of the Mesa Convention Center during the summer on Wednesdays from noon to 7. That's a new time and date. We've never done that before. And then Fridays from 7 a.m. to 3 p.m. So extended hours on Fridays. We're trying to make it to where we don't have this big crush of people coming to the convention center during a 3 or 4 hour period. So we don't have to utilize the police officers. We can help, cut them loose to go help out as things continue to evolve. But please let people know those are times they can come. We'll have the same food to distribute during the entire distribution, so you don't need to come early. You don't get better stuff if you come early or late. Just we want to, flatten the curve of people that show up for food assistance. So just wanted to let everybody know on this call. I know a lot of you interact with different agencies. So again, that's the Mesa Convention Center, Wednesday from noon to 7, starting this Wednesday, and Friday from 7 a.m. to 3 p.m. That's this Friday. So we'll be doing that schedule likely through the end of August right now is what the plan is. So we'll continue to monitor how many folks show up. I think we're getting, as the chief has said, we're starting to see the economic part of this turn on, and the pandemic part of it start to wane a little bit. And so we know that there's going to be a lot of food assistance and other mental health needs out there during this period. Is going to be equally as challenging. So United Food Bank's ready, and we've been grateful for our nonprofit partners who've also stepped up. And the volunteers in Mesa, we've had a ton of people show up, have been very helpful to us. So we're grateful for that.
Thank you very much for that, Dave. Appreciate it. I see there's want to make sure there's no other questions here in the queue before we. Okay, so the question for you, Dave, here is who do we contact if we would like to volunteer with the food bank?
If you go, so Grace Bishara coordinates all of our volunteers. The easiest way to do it is to email her. If you go to United Food Bank's website, I'll put her email in the chat box, but if you go to our website, there's a drop-down menu for volunteer. Just click on that and there's some options there and you can volunteer there. And I know United Food Bank isn't the only group. We serve 63 Mesa agencies. We've been working with the Parks and Recs and Facilities Department to fan out a lot of their employees to our member agencies as well to facilitate their food distributions. Because we've seen about a 20% increase in those agencies. So big shout out to Mesa Parks and Rec Department too for jumping right in, and we're trying to keep as many people busy as we can. And like Mary was describing, using some of those COVID funds to, I think we're going to rent the entire convention center for the next 3 months. So if you want to come down and help, you can come down and help there too. So.
Excellent. Thank you very much for that, Dave. You know, let's see. I do not see any other questions in the queue here. If anybody, I'm going to scroll through the screens here right quick and see. Okay. You know, one of the things that when Sally, myself, and we've gotten together with the chiefs, we wanted to open those lines of communications because we know that everybody is having their own challenges. But what I like to do, and Sally, we can talk more how we can continue to keep the conversation going. And if anybody has any ideas or suggestions, it could be a two-way street to see how we can support one another as we go through this. And of course, there is an expectation we might be going through this wave again this fall. And if there's anything we can do to prepare for that, we certainly can see how we could all work together as well. Sally, did you have anything else that you want to part with?
I don't really have anything important other than to say how much we appreciate our partnership with both PD and Fire. We know how hard everybody works, and we appreciate the fact that, you know, our community is so supportive and wants to get involved. So, you know, keep that in mind, because we do have people that want to step up and help, however that looks. You know, it kind of looks different for everybody involved. Looks like Norm might have something he wants to say. He's made himself large on my screen. Mr. DeVay.
Yeah. So as many of you know, or some of you know, maybe not many, but every year at COPA Health, which formerly is Mark Community Resources, we have an emergency preparedness conference that we usually put on in September. Last year it was in August, and the reason it was in August because it was in conjunction with the state and the national exercise called Crimson Contagion, which was planning for a pandemic. And so we had a fantastic conference last year planning for a pandemic, and we're going to be doing a follow-up conference this year with resilience during a pandemic and after a pandemic. So anybody that's interested, we're looking for stories, things that work, things that really helped you get through this or are helping you get through this. And I just I'm reaching out because we usually have a couple hundred people attend this. It's always been very successful. Forrest, I know if you remember Mary in the past when we've had active shooter conferences and other emergencies, I know you've taken part, but please keep in mind that if you have something that's really working, if something that you think you'd like to share, whether it's as part of a panel or you know, a white paper, something that you want to share, let us know, because we're really working to try to focus on obviously the developmentally delayed populations, mental health, seniors and children. That's what we try to do every year. So please, you know, contact me, and I think Sally knows how to get a hold of me. Most people do. If you have something you want to take part in that, or you want to share something during that conference in August or September. It's kind of weird to be thinking about evaluating while we're still in it, but it's something we have to think about ahead of time.
Right, right.
Thanks, Norm.
Thank you, Norm. Thank you. Chief Cameli, do you have any parting comments?
No, I just want to kind of match what Sally had just said. I appreciate the partnership too with the chamber and the businesses. You know, when we go through these things, working together makes it much easier for everybody. And thank you so much for your ongoing support for public safety. And we'll continue to serve the community out there, but we couldn't do it without the support that we received. So just to say, I really appreciate it. Thank you very much.
Thanks, Chief.
Thank you, Chief. Chief Cos?
Just the same. I mean, I feel so fortunate to have grown up in this organization and be with the city of Mesa and everybody here. I mean, it's not just a cliche. It's truly an outstanding community, and in times of crisis, you see, you know, what folks are made of, and I think we're seeing that right now. So I look forward to working with each and every one of you moving forward. So if you ever need anything, don't hesitate.
Okay. Well, again, thank you all of you for your support, and I'll be getting together with Sally. We'll have this audio obviously available in this video, and as we go along this next few weeks, we'll find a way where we can open up some channels of communications as to some partnership opportunities. As things go along here, we may see an opportunity for us to collaborate one way or another with your organization or with the Chamber of Commerce. So with that, I want to thank you very much for taking the time, and thank you again for all of your support.
Thank you, everyone. Have a great
Thanks.
day.
Bye-bye. Thank you.
Bye. Thanks, Chief.